Good afternoon, everyone. Welcome to the webinar on stem cell therapy for stroke and dementia. I'm Nicole Peck, a stem cell biologist by training, and I am here on behalf of Med-Mex Medical. I'm currently a senior PhD candidate here at Cincinnati Children's Hospital and University of Cincinnati. I have more than 8 years of research experience in the field of stem cell biology, so without further ado, let's dive right into the presentation. The outline of today's seminar is as follows. I will begin by talking little about dementia and stroke as well as their current treatments. I will then introduce what stem cells are and how stem cells can treat dementia and stroke. Lastly, Daryl will talk about Med-Mex services for providing this treatment. So what is dementia? Dementia is defined as the loss of cognitive functioning, including thinking, remembering, and reasoning. It progresses to the extent that it affects a person's daily life and activities. The World Health Organization estimates that more than 55 million people worldwide have dementia. Alzheimer's disease is a neurodegenerative disorder, and it is the most common type of dementia. Alzheimer's disease causes 60 to 70% of dementia cases. Several other diseases and brain injuries, such as a stroke, can cause dementia. Other forms of dementia include vascular dementia, dementia with Lewy bodies, abnormal deposits of protein inside nerve cells, frontotemporal dementia, degeneration of the frontal lobe of the brain, and mixed dementia. Age, physical health, level of activity, family history, and medical history are some key risk factors for dementia. The illness gets worse over time. It mainly affects older people, but not all people will get it as they age. What are the signs and symptoms of dementia? Well, changes in mood and behavior sometimes happen even before memory problems occur. Some of the early symptoms include memory problems, increasing confusion, reduced concentration, personality or behavior changes, apathy and withdrawal or depression. The patient also can experience loss of ability to do everyday tasks, difficulty speaking or reading and writing, plus loss of balance and problems with movement. It is important to note that dementia affects each person in a different way, depending upon the underlying causes, other health conditions, and the person's cognitive functioning before becoming ill. Most symptoms become worse over time, and as the disease progresses, the need for help with personal care increases. In later stages, dementia patients' behavioral and psychological symptoms, which will lead to functional loss and decline in quality of life. These symptoms of later-stage dementia may include increased agitation, anxiety, wandering, aggression, delusions, and hallucinations. In normal aging, the brain may shrink slightly, but the number of brain cells and neurons doesn't change significantly. However, dementia causes dramatic structural and functional changes in the brain. In Alzheimer's, some of the structural changes that occur include shrinkage of cerebral cortex, enlarged ventricles, and shrinkage of hippocampus. The loss of brain size and volume is also known as brain atrophy. So what are the consequences of these changes? The cerebral cortex of the brain is responsible for cognition. This explains the loss of cognitive abilities in patients. Enlarged ventricles are often present in dementia patients with underlying neurodegenerative diseases. The hippocampus of the brain is responsible for retrieving memories, which again explains the loss of that memory experienced by patients. Functional changes in the brain can be evaluated via functional imaging. Some of you may be familiar with PET scan, which can show us chemical and functional changes in the brain. Here is an example of a PET scan comparing a normal brain to one with mild cognitive impairment from Alzheimer's. You can clearly see a huge difference: more inactive regions in Alzheimer's patients. Current treatment for dementia depends on the underlying cause, but no medications have been shown to prevent or cure the condition. Current therapies focus on treating the behavioral and cognitive symptoms to a certain degree, but they do not address the underlying biological processes. In addition to medications, some therapeutic strategies include dietary interventions and physical activity. Common medications used to manage and relieve some behavioral and cognitive symptoms can be classified into 3 types. 1. Cholinesterase inhibitors, which treat symptoms related to memory, thinking, language, judgment, and other thought processes. 2. Glutamate regulators, such as memantine, to improve memory, attention, reason, language, and the ability to perform simple tasks. 3. Immunotherapies, such as aducanumab, which target and remove the harmful amyloid plaque deposited in the brains of Alzheimer's patients. aducanumab was discontinued in May and will officially be unavailable by this November. As with most medications, they may not work for everyone, and different patients respond very differently to them. Known side effects of these medications include fatigue, diarrhea, vomiting, nausea, weight loss, dizziness, or even confusion. Moving on to stroke now. Stroke is a disease that affects the arteries leading to and within the brain. It occurs when a blood vessel that carries oxygen and nutrients to the brain is either blocked by a clot or bursts. When this happens, part of the brain cannot get the blood and oxygen it needs, causing brain cells to die. Stroke is the second leading cause of death and disability worldwide. Medical risk factors for stroke include high blood pressure, elevated cholesterol levels, heart disease, atrial fibrillation, diabetes, and obesity. The signs and symptoms of stroke depend on the type and location of the brain affected. Some common signs and symptoms may include sudden confusion, with trouble speaking and understanding speech, sudden numbness or weakness, especially on one side of the body, sudden severe headache with no known cause, sudden trouble seeing from one or both eyes, sudden trouble walking, dizziness, or loss of balance or coordination. There are two ways a stroke can occur, as briefly alluded to earlier. The first way is from a blocked artery, which means that the blood flow is obstructed by blood clots or other particles. This results in an ischemic stroke, which is the most common type of stroke. The second way is from a ruptured artery, leading to a hemorrhagic stroke. High blood pressure and aneurysms balloon-like bulges in an artery can cause the artery to stretch and eventually burst, resulting in bleeding inside the brain and causing a hemorrhagic stroke. Blood flow to the brain is crucial for brain function, so when it is cut off, either from a blocked or ruptured artery, the brain is negatively impacted. How one is affected by a stroke depends primarily on the location and extent of the damage to the brain tissue. The injured brain area can be identified using imaging technologies. For example, in a CT image of the brain, injured tissue from an ischemic stroke appears darker compared to the surrounding brain, while injured areas from a hemorrhagic stroke appear lighter due to the presence of blood. A stroke on the left side of the brain affects the right side of the body, while a stroke on the right side of the brain affects the left side of the body. Treatment depends on the type of stroke, the time elapsed since the onset of symptoms, and any associated medical conditions. Common preventative medications include antiplatelet drugs and blood thinners to reduce blood clotting. Treatments for ischemic stroke. Recombinant tissue plasminogen activator RTPA. This medication restores blood flow by quickly dissolving blood clots causing the stroke. Blood thinners. These are used to prevent the clot from getting larger. Procedures. Thrombectomy. Physical removal of the clot from the blood vessel. Angioplasty and stenting. Insertion and expansion of a balloon or small mesh tube into the artery to clear space and increase blood flow. Treatments for hemorrhagic stroke. Medications. These include drugs to reduce blood pressure or vitamin K to help stop the bleeding. Procedures. Aneurysm clipping. Clipping the area of leaking to stop the bleed. Coil embolization. Insertion of a coil into the leaking vessel to seal it off. Despite these treatments, none of the conventional medications or medical procedures can promote brain regeneration and recovery. Consequently, many stroke patients still face reduced physical abilities and an overall diminished quality of life. So, based on the past couple of slides, you can tell that traditional medicine and medical procedures to treat dementia and stroke are highly focused on managing the symptoms, but they do not target the underlying root cause, and nor do they focus on regaining a healthy and functioning brain. Therefore, we need to explore alternative approaches that are specifically focused on promoting brain recovery, repair, and regeneration. One such alternative is stem cell therapy, which is what we will be talking about for today's presentation. This brings us to stem cells. Many people mistakenly associate stem cells with plant cells, but stem cells are unique human cells that serve as building blocks capable of becoming any cell type in the body. Stem cells are also unique in that they have the capability to both repair and replace damaged cells. There are many different types of stem cells, each with distinct properties, depending on where they are found. The most common type of stem cells used to treat brain and nerve conditions come from tissues like the placenta and umbilical cord. These are called perinatal tissues, which include things like the placenta, amniotic fluid, and umbilical cord blood. Perinatal stem cells are special because they share qualities with both adult and embryonic stem cells, giving them more flexibility. Since these tissues are usually thrown away after birth, they provide a great and ethical source of stem cells. Over the last decade, scientists have used these cells to treat many diseases, especially blood and immune system disorders. In this presentation, we'll focus on stem cells from the umbilical cord. There are two main types: hematopoietic stem cells found in the cord blood and mesenchymal stem cells MSCs found in the umbilical cord tissue. Med-Mex uses the mesenchymal stem cells for treatments. Later on, we'll explain why these cells are best for treating stroke and dementia. Umbilical cord mesenchymal stem cells are very promising for stem cell therapy. They are safe and won't cause an immune reaction. In fact, they help reduce inflammation and have been used to treat conditions like diabetes, autism, cerebral palsy, spinal cord injuries, strokes, Alzheimer's, Parkinson's, and other dementias. What is stem cell therapy? Stem cell therapy, also known as regenerative medicine, promotes the repair of diseased or injured tissues using stem cells. There are two ways stem cell therapy can achieve this. Replacement of diseased cells. Stem cells can differentiate into the specific types of cells needed to replace the damaged or diseased cells. Paracrine effect. Cell regeneration. Stem cells release bioactive molecules called exosomes that induce other cells in the body to regenerate and repair themselves by stimulating the body's own healing processes. How stem cell therapy works. Cell replacement. The goal of cell replacement therapy is to replace dead or damaged cells to help organs work better. Stem cells are placed in the affected organ, like the liver or brain. For example, in liver disease, stem cells are used to become healthy liver cells and are then transplanted into the liver. These new cells start working, helping the liver function again. The same idea applies to the brain, where healthy cells replace damaged ones. How umbilical cord stem cells MSCs help treat diseases like dementia and stroke. The paracrine effect is when cells release special proteins that send signals to nearby cells, helping them do certain jobs. These signals don't travel far but affect the cells around them. MSC's umbilical cord stem cells mainly work through this paracrine effect, using 4 key actions. Regulating the immune system. MSCs help control the immune response, reducing inflammation and stopping more brain cells from being damaged. Preventing cell death. They release proteins that stop brain cells from dying, which helps protect the existing brain cells. Encouraging blood vessel growth. MSCs help grow new blood vessels, which increases the blood flow to the brain. This is important for brain cell health and function, helping brain cells regenerate. They assist in creating new brain cells by turning stem cells into the types of brain cells that have been affected by the disease. Together, these actions help treat dementia and stroke by replacing damaged cells and reducing inflammation. In Alzheimer's disease, MSCs may also help reduce harmful amyloid plaques in the brain. What are exosomes and how do they work? Exosomes, also called extracellular vesicles (EVs), are tiny sacs that stem cells release into the bloodstream. They help cells communicate with each other and are involved in important processes like helping cells grow and repair. Exosomes carry proteins, fats, RNA, and other molecules that can affect how other cells behave. Exosomes are now being studied for their potential in diagnosing and treating diseases. They can act as markers for certain conditions and can even be engineered to carry medicine directly to specific cells, making them useful in treating diseases like cancer, brain disorders, and heart problems. Scientists have found that exosomes from mesenchymal stem cells MSCs work just as well as the stem cells themselves. This means that exosomes might have the same benefits as the stem cells they come from. For dementia and stroke, stem cells and exosomes are being studied because they may help repair and regrow damaged brain tissue. This could lead to new ways to treat and recover from these conditions. In one study on mice with Alzheimer's disease, exosomes from MSCs helped reduce harmful beta-amyloid plaques shown here as green specks. In this study, the exosomes were injected directly into the brains of the mice. Next, let's look at how stem cells can be introduced into the body. What are some of the delivery methods people are using at the moment? One of the most commonly used routes for delivery is the intravenous IV injection or infusion. It is the safest method of stem cell delivery, Researchers have found that MSCs have incredible homing abilities, which means that they can be transported by the blood and go to damaged tissues. However, one thing to note is that studies have found that the stem cells may get retained in the lungs, liver, and even spleen. This could limit the amount of stem cells that can get to the brain, which is where we want them to be. To overcome this challenge, a higher dose of stem cells with the addition of many exosomes may be required. Exosomes are much smaller and pass through the organs easily. An alternative delivery route is intrathecal administration, which is a commonly used route of administration for drugs via an injection into the spinal canal. An example is a spinal block for childbirth. It is used so that the stem cells reaches the cerebrospinal fluid CSF without passing through organs. This procedure is called a spinal tap. Compared to direct intracerebral delivery, intrathecal cell injection is less invasive and allows for a higher cell injection volume. Intrathecal MSC administration has already been shown to be safe and has already been used for the treatment of some other conditions. Let's review the tests used to diagnose dementia. There are two types: written oral tests and imaging assessments. Written oral tests, Mini Mental State Examination MMSE, a widely used 30-question test that assesses cognitive impairment, with scores ranging from 1 to 30. A score of 1 indicates severe impairment, while 25 to 30 is considered normal. It is a standard and accurate test. Clinical Dementia Rating CDR-E, an alternative to the MMSE, this scale evaluates the severity of dementia. Imaging assessments. Imaging techniques are also used to assess brain structure and function in diagnosing dementia. For stroke, the Barthel Score Index BI is most commonly used. This score is a measure of mobility and dependence of the patient on a scale from 1 to 100. There are several other alternative written tests as well as imaging tests, including MRI and PET scan. Med-Mex uses the MMSE and the Barthel Index to measure the patient's dementia and stroke as well as mobility and dependence. Current research on stem cell therapy for dementia and stroke. Right now, there are 54 studies on using stem cell therapy for dementia and 94 studies for stroke. Out of these, 13 studies for dementia and 21 studies for stroke are specifically using umbilical cord stem cells (UBMSCs). Umbilical cord stem cells have already been tested in early-stage clinical trials phase 1 in the USA and Canada for treating Alzheimer's disease and stroke. The goal of phase 1 trials is to check if the treatment is safe and to figure out the right dose. However, one downside of phase 1 trials is that they usually have only a small number of participants. Next, we'll look at some examples of these studies. Research from Duke University, the University of Miami, and MediPost in South Korea all show that treating dementia and stroke with MSCs is both safe and effective. There were no reports of serious side effects like severe adverse events or problems with brain scans related to amyloid plaques. Countries like South Korea, China, Russia, and Mexico have approved the use of stem cells to treat brain diseases. Study on stem cells for treating vascular dementia. A group of researchers at the Second People's Hospital of Kunming in China tested the use of umbilical cord stem cells MSCs to treat vascular dementia. The stem cells were given to patients through an IV. After 3 months, patients' average cognitive scores on the MMSEA test for memory and thinking skills improved from 14.7 to 18.0. On the MSE, lower scores mean more severe dementia. Usually, dementia patients' MSE scores keep getting worse by about 0.75 points every 3 months, making the improvement seen in this study even more impressive. The improvement in MSE scores from using UCMSC therapy is a promising result. The researchers also looked at how the patient's movement and daily activities improved. Before treatment, patients had an average score of 29.6 on the Barthel Index, which measures how much help they need in daily life. After 3 months, their scores improved to 55, showing they went from being very dependent to only partially dependent after the stem cell treatment. Right now, stem cell therapy is the only treatment that may not just slow down but also reverse cognitive decline. In summary, stem cells contribute to treating dementia and stroke in 5 key ways: repairing blood vessels in the brain, strengthening the immune system, preventing brain cell death, reducing amyloid plaques, promoting the growth of new brain cells to replace damaged ones. The effect of these treatments. The combined effects of these treatments work to halt the progression of dementia and stroke, reduce the likelihood of a new stroke, and reverse the damage caused by these conditions. As a result, patients experience improved cognitive function, better brain processing, enhanced mobility, and the greater independence in their daily lives. Countries that have approved stem cells for dementia and stroke. Mexico approved. Stem cell treatments have been used in Mexico since 1988. One major breakthrough came from Dr. David Gomez Almagor and his team at the University Hospital in Monterrey. Mexico sometimes follows other countries' approval processes for new drugs and treatments. Today, Mexico allows the use of stem cells to treat neurological diseases, like dementia and stroke. Japan approved. Japan is more advanced in its approval process for regenerative medicine, including stem cells. The country's fast-track system allows stem cell treatments to be approved quickly if they are shown to be safe and effective. Japan's agency that regulates drugs and medical devices, PMDA, has approved stem cell treatments for various conditions, including neurological diseases. South Korea approved. South Korea has a strong regulatory framework for stem cell therapies. The Ministry of Food and Drug Safety, MFDS, has approved multiple stem cell-based treatments. South Korea is recognized for its openness and speed in approving innovative medical treatments, including those for neurological disorders. China and Russia approved. China and Russia have both approved the use of stem cells for treating neurological diseases. Along with South Korea, these countries adopt a more holistic approach to medicine and are advancing in the use of stem cell therapies. Global context. Many other countries are working toward approving stem cell therapies and are conducting clinical trials in leading universities and government agencies. The USA, European Union, Japan, Australia, and Canada all have ongoing trials aimed at achieving eventual approvals. Why choose Mexico for stem cell transplants? Stem cell treatments have been used in Mexico since 1988, with a significant breakthrough led by Dr. David Gomez Almagor and his team at the University Hospital in Monterrey. While Mexico often follows the approval processes of other countries for new drugs and treatments, it has taken the lead in allowing the use of stem cells for treating neurological diseases, including dementia and stroke. In contrast, stem cell therapy for neurological treatments, like those for dementia and stroke, are still in clinical trials in the USA and Canada, and therefore not yet available for widespread use. However, the Mexican government has fully approved its use and has established regulations to ensure the safe and ethical practice of stem cell treatments. Here's why Mexico stands out. Eligibility. Not all patients qualify for stem cell treatment, and not all illnesses can be treated with stem cells. There is a thorough qualification process to determine if a patient is eligible. Certified clinics and laboratories. Only a select number of clinics and laboratories meet the rigorous standards set by Mexican health authorities, ensuring high-quality treatments. Established regulations. Mexico has implemented comprehensive regulations that oversee stem cell therapy, ensuring the treatments are safe, ethical, and effective.
If you decide to pursue stem cell treatment for dementia or stroke, Med-Mex offers a comprehensive, turnkey service to manage your entire journey. The Med-Mex process starts with a cognitive and medical assessment. Initial assessments. The cognitive assessment evaluates the patient's dementia, mobility, and independence, while the medical assessment records the patient's medical history and comorbidities. Treatment plan. Med-Mex reviews these assessments to determine if the patient is a suitable candidate for treatment. If deemed suitable, Med-Mex designs a personalized treatment plan and provides an estimate of the costs. Doctor and hospital. Once the patient decides to proceed with the proposed treatment plan, Med-Mex schedules and books the doctor and hospital on the patient's behalf. They also coordinate the purchase and delivery of stem cells from the laboratory to the hospital just before the procedure. Travel arrangements and accommodations. Your treatment will include 4 one-hour intravenous sessions over 10 days, 2 for stem cells and 2 for exosomes. Med-Mex handles all travel arrangements, including flights from your nearest international airport and back, so you can focus entirely on your treatment. Airport pickup. Med-Mex will meet you at the airport in Mexico and escort you to your hotel. During your stay, you will have access to a driver, translator, and concierge who will take care of all your needs and ensure a comfortable experience. During your time in Mexico, you will have 10 days between treatments. During this time, you will stay at your hotel. A concierge, translator, and driver will organize any activities you wish to pursue, including sightseeing, shopping, and travel. If your mobility and independence are a concern, we can arrange for your entire stay to be in the hospital. If you stay in the hospital, the concierge, translator, and driver will assist in bringing anything you may need or help you get out for a day or two during your stay. 2 quarterly assessments. After the treatment, Med-Mex will conduct 2 quarterly assessments to monitor your progress.
Are there side effects from stem cells?
Safety and side effects. Stem cell treatments for dementia are generally considered very safe and have been administered to thousands of people with minimal risk. However, during the first 2 weeks after treatment, some patients may experience the following symptoms: fever and flu-like symptoms. These can be managed with over-the-counter medications, headaches, nausea, allergic reactions, rare cases of itching and scratching, dizziness and lightheadedness. Fatigue.
How long does it take to see results?
You will begin to see results within 3 weeks, with improvement continuing over the course of 8 months.
What is the total cost?
The total cost for stem cell treatment, including 2 treatments of stem cells and 2 treatments of exosomes over 2 weeks in Mexico, as well as travel, accommodation, doctor, hospital, biological stem cells and exosomes, plus concierge driver and translation services, range from $14,500 to $19,000 USD, depending on your neurological and medical assessment and travel season.
How much does it cost for a companion?
If you add a companion who will stay in their own hotel room, the additional cost is $2,500 USD.
How soon can I go for the procedure?
It takes a minimum of 2 weeks to make all the arrangements. Patients generally proceed with treatment 3 weeks after deciding to move forward. Thank you for your time. The next step is to complete your medical and cognitive assessment. This assessment is free and conducted virtually by our intake nurse, Casey Malaika-Lasola, who holds a major in nursing administration and has 12 years of experience working and managing dementia wards. To schedule your free virtual assessment, text us at +1 2 2 6 2 3 9 6 6 9 9 with the word assessment. Casey will contact you to schedule a time. The assessment can be done by text or over the phone, and it is completely free with no obligations.